Royal College of Surgery in Ireland, and he is also an associate professor of surgery of UPM, consultant surgeon in HKL before private practice, and also a pioneer consultant general and gastrointestinal surgeon of Thompson Hospital. So without further ado, ladies and gentlemen, everyone claps and say wow, clap! Dr. Kwan, Keat, Leong. This is me. My name is Kwan, okay? And today I'm going to share with you a topic. It's called A Healthy Gut, A Healthy You. Okay? So I'm interested in this. So if there's the launching, please call me along. You must be wondering, why you call a surgeon to come and give a talk of related to probiotic or something related to a healthy gut? Isn't it better calling another doctor instead of a surgeon? Seriously, initially I also think so. But I'll tell you why you should call a surgeon, okay, after this. Okay, the things that looks very ugly looking, okay, but these are the common diseases that I see in my practice, okay? These are so-called bread and butter of my practice, okay? This is a gallbladder infection. Then after that, that is the appendix at the right hand. And this one, obviously, you can know is someone who has a food poisoning. That one is, you know, the buttock got pus. And the up and down there are both, okay, the gastritis and also colitis. Okay, at the end of the day, the cause of all these things, or the underlying cause of all these things is infection. Correct? So, a lot of people will then say, most of the patients say, doctor, how can I get, why I get gallbladder infection, why I get appendix infection, why I get gastric, why I get colitis? Is it because someone passed it to me or something like that? Actually, the answer is no. The answer is because you got it from yourself. Okay? So, another thing is, now it's 2025, right? Now, 2025, we are not talking about cure anymore. We are talking about prevention. Okay? So, very soon, surgeons got no work to do anymore. So, surgeon only can give talk. No. And in order to understand how we are going to prevent, we must then look into our own gut. Okay, first come to this word, gut microbiome, very big word, okay? But don't worry. Basically, microbiome means it's an ecosystem. It's an ecosystem of all the germs, okay? Bacteria, fungus, virus, inside your intestinal tract. That means all the way from your mouth, all the way to your anus. Okay? So, are you surprised that actually you now, no matter how clean you are now, you are carrying trillions of microorganisms inside you, you know? All of you are having trillions of microorganisms without you realizing. And by the way, the number of cells in your body is much less than this organism. That means they outnumber your cells. And without you knowing, you are creating trillions of microorganisms. Some of these viruses, fungus, bacteria, and also parasites inside the gut. Okay? Now, the next thing is the slide on this side, because now you just need to remember one thing only. As it goes down, that means from the mouth, then you go to the stomach, you go to the small intestine, and then you go to the colon, the large intestine. You just need to remember one thing. The number of bacteria are increasing. Okay? So that means number of bacteria in your anus are maximum. Okay? The one that is less is in the mouth. Okay, that's number one. Number two, that one, look at the side on the other side. I want to show you that the so-called oxygen. So the oxygen level in the intestine is getting less and less. Then another thing is, I want you to notice the bacterial load, as I mentioned to you, is increasing as you go down. And then the one in yellow, the mucus thickness, you can see the mucus thickness is actually quite in the colon and in the stomach. Now, I point out all these things is because after this, I'm going to talk about this. Okay, so this gut microflora or microbiome is very unique, you know. So next time you don't need IC anymore, you can use this as your ID, you know. Okay, it's very unique one. Even identical twins also, the gut microflora is different one. Okay, so what affects this gut microflora? Okay, of course, the diet, what you eat. Okay, and then if you take antibiotics, of course, you kill some of the bacteria. Then geography. So the gut microflora, someone who lives in China is obviously different from someone who lives in Africa, and obviously is different from someone who lives in America. Okay? Because of their eating habits and everything. And then if you are stressed, okay, then you know, when you do exercise or you don't do exercise, and then depends on the certain life cycle. They should say someone's a 4-year-old child's microflora will be definitely different from a 20-something years old man, will be definitely different from a 40-year-old lady, and will be different from the 60-year-old man. Okay? It will be different. And what is more interesting is, I saw there are a lot of ladies here, so some of them are probably going to give birth or going to get pregnant with you all. Someone who is delivered through vaginal delivery, that means normal delivery, compared to someone who is doing cesarean section, their gut flora also will be different. Okay, actually, inside our mother's womb, our intestine is sterile, that means no bacteria at all. It's during the birthing process, when the child go through the vaginal canal, all these things, that's where they swallow and all the things, and then they get their bacteria. So the bacteria of the child is identical to the bacteria of the mother. So that's why women are very important, isn't it? Breastfeeding and formula feed, also the bacteria will be different. Okay? So on the right side, you can see there's a comparison between vaginal-born breastfeed, vaginal-born bottle feed, and cesarean section, just to show you that it's very different. Just like anybody in this world, there's always good, there's always bad. So these bacteria, some are good bacteria, some are bad bacteria. Okay? Now, you just need to remember those that I highlight. You don't need to what? You just remember those few names. Lactobacillus bifidobacterium. Because after this, Bilal will say something regarding lactobacillus and bifidobacteria. Okay? So what you need to know is the relationship between this bacteria and us is symbiosis. Like in your business world, you call it win-win situation. What you do is the host, that means the human, provide the food and shelter to the bacteria. In return, the bacteria do something to give health and wellness to the host, that means to the human. So it's a win-win situation. So you'll be surprised, right? Something very, very small is actually giving you health and wellness. You'll be even surprised later afterward. You all have heard something called complex carbohydrate, right? Yeah. Complex carbohydrate, actually, our body itself cannot digest it. Okay? We need the help of these bacteria to digest it. Okay? We cannot digest it ourselves, you know. So, and one of the complex carbohydrates is found in breast milk, you know. Breast milk you have something called oligosaccharide. Okay, so they cannot be digested by human one. We need this bacteria to digest it. And when this bacteria digests it, it's through a process called fermentation. Okay, and then it produces a metabolite. Remember, this is also very important. You just need to remember all these things. This metabolite is called SCFA, short chain fatty acid. Okay, and this is something that probably nobody knows, and you just found. Do you know the cell that lines the intestine? All these cells that line the intestines. Actually, they get their energy not from the human, you know. They get their energy from the bacteria. Can you imagine your own cell is the bacteria who give them the energy? And this SCFA, as you can see, you go through, then it produces energy. ATP is something related to energy. Surprise, right? Okay. So, and then another thing is vitamin B, vitamin K. Every day you have been taking vitamins, right? A lot of vitamins, every day pop, don't know, 20, 30 vitamins a day in the morning, is it? The more expensive the vitamin, the better, the happier you are, right? Yeah. Do you know that our body cannot synthesize vitamin B and vitamin K? That's why you have to take vitamin B complex. And it is the bacteria that synthesizes it for you. So your vitamin K and your vitamin B comes from this bacteria. And last thing is the fatty acid, okay? It's the bile acid. So basically, okay, this bile acid is secreted by the liver. It digests fat and oil, but eventually it will need to go back to the liver. So to go back to the liver, it needs to be converted to something else. And the one who do this, who responsible for this, is also those bacteria. It's not the human. If this thing is no check and balance, that's what happened now. Okay? Then you create a havoc. Okay? So, how do you do about this? And for our Muslim and Indian colleague, so basically, this thing, kalau there is no check and balance, just like the pembangkang and the pemerintah, the parliament will bergaduh, you know. So it must be kept check and balance, okay? If not, this equilibrium will go into havoc. So how do we do that? Okay? So the first thing is basically competition. Okay? Competition for territory, 爭地盤啊. Okay? And competition for food, 爭搵食啊. Okay? So basically, this, put it this way, this bacteria, this bad bacteria, if being check and balance, they don't dare cause havoc. But just this fellow went for a holiday or something like that, suddenly, wow, this guy 大晒啦, you know? Then it will cause a havoc. So it must be check and balance. And apart from compete for food and compete for territory, the good bacteria actually can secrete something called bacteriocin or cytosine and kill and inhibit these bad bacteria. So basically, the keyword here is must keep it check and balance. Okay? So another thing is, sorry, it is very detailed. Okay? Now, you see, our gut is very interesting. We have to take in food from outside to go. That means this food is outside. It has to go into our body. That means through digestion and everything and absorption. Okay? So, how do we do that? So, these are the normal cells that line the intestine. Okay? Remember just now I was talking about the mucus thickness? Okay? This is the mucus thickness. This layer is the mucus layer. So you can see all the bacteria are actually not direct contact with these cells. They are separated by these layers. Okay? So this is like a buffer layer. Okay? To help prevent all these things. And then these cells all they are very tight together one, you know. It's all stuck with all these things one, you know. Okay, it's very tight one, you know. So basically cannot go in at all one, you know. Air also cannot go in. But when the ecosystem has been changed, okay, this thing opens up, no more so tight. The mucus level all got thin out, being eaten already. Now you can see all the bad bacteria all coming. So this is another second level of defense, our body defense, you know, to prevent all these bacteria from causing trouble. It's another way of keeping them check and balance. Do you know that our immune system is actually being trained by this bacteria? Not trained by your mothers, not trained by your teachers, you know, trained by this bacteria. So basically, how do they train that? Okay, so the bacteria will say, look, this bacteria is your friend, so you don't create a reaction that will harm him. That bacteria is your enemy, you better kill that bacteria. Okay, that's how they train it. So when they do like that, you can see, okay, just say this is a good bacteria, so the reaction is not so hostile. But in this one, it's a bad bacteria, you can see the reaction is very hostile and very wild. So basically, the one that train your immune system is actually these bacteria, you know. They train it. Okay, it's as if they are talking to each other, you know. They got some secret Morse code or something like that, they're talking to each other, you know. There's a crosstalk between the bacteria and your immune system. Now, another concept. Now, I bring out all this immune system, gut-brain axis and all these things. It's all because to complementary our next lady afterward. You will soon understand. Now, I'm sure everybody have heard of this word called gut feeling. My gut feeling is the share market is going to go up tomorrow. And then Donald Trump sent one tweet and said, oh, your gut feeling is gone. Okay? So that means the one who make the decision is your gut, you know, it's not your brain, you know. And that happens many a times, right? Especially when you want to buy shares, buy gold, buy diamond and all these things, right? So, it's as if the gut, the bacteria, they are talking to each other, you know. The gut is talking to the brain and the brain is talking to the gut, you know. So that's why come to this term called gut-brain axis. Okay, and the thing that is involved is, you know, this called enteric nervous system. That's it, with the nerves in the intestine, which nowadays people say this is the second brain. So 有時用腸嚟諗嘢㗎。Guna usus untuk berfikir. That's why a lot of people die in share markets. Remember just now I mentioned the word short chain fatty acid. So how they talk to each other is through all this special thing called short chain method fatty acid. And I'm sure you all heard of serotonin, dopamine, and all these things and everything. And then, okay, the brain said, okay, the gut tell me this. Okay, I'm going to tell the gut to do what. So they send something down to the nerves and everything to tell the gut what you need to do. So one very simple diseases that tell you all these things is, I'm sure you all have heard of it. It's called irritable bowel syndrome. Have you all heard about that, irritable bowel syndrome? So, so irritable bowel syndrome, last time when I'm a medical student, they said, you do everything already, you do all the investigation, if you cannot find out the cause, you label the person irritable bowel syndrome. So nowadays, we found that irritable bowel syndrome and anxiety are very related. So that means someone who got anxiety, they are also very common, they will have irritable bowel syndrome. On the other hand, someone who has irritable bowel syndrome also more susceptible to anxiety. For someone who is actually anxious, depressed, don't know for whatever reason, they also got constipation, they also can have diarrhea one, you know. So it's related one. Okay? So that's explain that this gut brain axis really exists one, you know. So since now you know the gut microbiome is so important, so what are you going to do to protect them? Number one, eat a lot of fruits and fiber. Number two, eat a lot of fermented food. So kimchi is one of them. So you can go and eat Korean food after this. Tofu is another one. Okay, yogurt, all these things are the fermented food. Have a very good sleep. Okay, now a good sleep is very important. Okay, and then of course exercise. Okay, and things that you should avoid are all the processed food, hamburgers, donut, and of course, unnecessary use of antibiotics. Okay? No, I'm not trying to say that you shouldn't use antibiotic. I mean, if it's indicated, please. But if it's not, you know, don't. Because this antibiotic is going to wipe out the gut microbacteria. And of course, the most important is probiotic. That's what you are all coming here for, isn't it? Now, this is the second part of my talk. I prepared some frequently asked questions about probiotic. I think you all would like to ask one. Okay? So the question number one. What's the difference between probiotic, prebiotic, and postbiotic? Correct? Probiotic, very simple. Life. The organism is life, a live one. Okay, you need the probiotic, the organism must be a live one. Okay, that is the key word. Okay, and remember just now I mentioned this word, lactobacillus and bifido. Okay, you remember this after you see the tetrabiotic, the behind there, the contents and the ingredients, you can see these two words. Okay, then what is prebiotic? Remember, we mentioned that it's a symbiosis relationship. The human provide food and shelter to the bacteria. So, you got probiotic, you must give food to the probiotic, to the bacteria. Okay? So, prebiotic, you just need to remember, is the food that feed this bacteria. And the commonly used, remember just now I mentioned these oligosaccharides, the one very difficult to digest one. So the one that is common in the market is fructose and galactose oligosaccharides. You soon see all these things when you buy a packet of tetrabiotic. Okay, then what is postbiotic? Okay, postbiotic basically, after the bacteria eat the prebiotic already, so sudah makan kadang-kadang kena buang, betul tak? Okay, so they have to metabolize those food. So those food, the metabolites, okay, those are the postbiotic. And the one that is most common one is short-chain fatty acids. This one only recently I heard, after KL Tower, then only I heard of this term. Upon Street, sorry. Paraprobiotic. I thought, what is that, And that is actually the one that made me interested in coming to hear this talk. So, paraprobiotic, basically you can think it as a probiotic, but the cell has been inactivated. Okay, sorry to use this word. Inactivated already, non-viable already. Now, why this term paraprobiotic is coming in, and probably is going to be more in the future, because nowadays there are some people who say, I take probiotic, but the bacteria is alive one, will it affect me and will it threaten my life? So if in the coming future, if there's someone say that the effectiveness or the efficacy is the same like probiotic, but it's not a live one. I think people will tend to buy in better, isn't it? Just remember this keyword. And so this is the relationship between probiotic, postbiotic, paraprobiotic, and prebiotic. I'm a surgeon. Okay, I use probiotic, but I only use probiotic when it's medically indicated. Okay, a lot of people knows that I don't like to prescribe medicine unless it's necessary. So what are the absolute indication where you can use probiotic? Don't say I got headache, I use probiotic. I cannot go and poo-poo, I use probiotic. A lot of y'all do that, right? Dr. Give. Okay, the absolute medical indication for probiotics actually, yes, there is a role for probiotic, but we are using it as treatment. Okay? So we treat those that have food poisoning diarrhea. That one, yes, we use probiotic. We use, after someone who has been given a many multiple courses of antibiotic, for whatever reason. Recently, I just got one patient like that. Said, you got so many courses of antibiotic just for urine infection. Then, yes, you need to take probiotic because all the gut bacteria actually has been wiped out already. And remember just now I mentioned the word irritable bowel syndrome? Yes, there's an indication of giving probiotic for irritable bowel syndrome. Which are these patients that you cannot give them probiotic? So these are those people that are immunocompromised patients. That means those patients, the immune system is very low already. So one simple example are those cancer patients who is undergoing chemotherapy and radiotherapy. And premature infants. Okay, that means those baby, not term baby. Okay, because their system has not fully developed yet. So, now I choose all these things because these are the things that people seldom talk about. Yeah. Okay, this one I only know about it after I met William. Now, as I told you before, I use probiotic, but those probiotics that I use are medical grade probiotics. Okay, but they are also food grade probiotic. There are two different things. One, I'll tell you what's the indication. What's the implication? What is medical grade probiotic and what is food grade probiotic? There are, because I use probiotic. Of course, the probiotic that I use are medical grade one. So medical grade probiotic, if you see their box or something like that, they got this number. Want to know MAL number? They got MAL here. So these are medical grade probiotic. Okay? If you go and the shop there, you go and look at the one, no MAL one, then it's a food grade probiotic. Okay? And by and large, medical grade probiotic, because it's for treatment, of course it's stronger. So the CFU, which is the colony forming unit, will be higher one. Usually it's 10 to the power of 9 and above, or 10 to 10 to the power of 12 or something like that. The food grade probiotic probably will be less than 10 to the power of 9 CFU. Okay, now this is the most important. Why you need to know that probiotic is medical grade and food grade. Medical grade probiotic is not meant to be consumed lifelong. It's not a supplement. Medical grade probiotic is only meant to be used for a certain period. It's meant for treatment. My last slide will be for this. So what is tetrabiotic? It's a combination of probiotic, prebiotic, postbiotic, paraprobiotic to give human health benefit. Thank you so much.
And we have been waiting for, which is the launch of Tetrabiotic. And now we would like to invite Dr. Kwan, Miss Billion, and Miss Cheryl to take your photo and palm on the screen. Yes, palm on screen and face on the camera. Okay. Everyone, get ready your smartphone. Get ready your camera. Ladies and gentlemen, are you ready?
Yes!
Right, if you are ready, let's count down together in 5,
4, 3,
2, and 1. Big round of applause and congratulations to Keat Nutrition on the official launch of Tetrabiotic. Not only here at our HQ, but also simultaneously on B Mall today across Malaysia, Hong Kong,